there are so many different forms of dystonia. When people are approached by a patient with dystonia, they quite often face difficulty because clinically, patients may all look like they have a dystonic syndrome, but the etiology, meaning what is the cause of it, may be different. So there are obviously acquired causes, but there are also a lot of genetic causes. And the list of genetic causes of dystonia is increasing day by day as we are discovering more genes, and also because of the new techniques which we have with next generation sequencing or advanced sequencing techniques. I expect that this will in fact increase even further. So I think before I answer your question, I would say that we need to answer the question, why is this important? Why do we want to make or realize that there are different genetic forms of dystonia? Well, that's mainly because the prognosis, i.e. what will be the course, what will be the progress of the disorder, is different in different forms of dystonia. So therefore, it becomes very important to know what is the underlying genetic cause. So just to give an example, for example, DYT1 gene-related dystonia responds extremely well to deep brain stimulation surgery, while certain other forms, for example, rapid onset dystonia Parkinsonism, does not respond very well to deep brain stimulation surgery. We know that, for example, DYT1 gene-related dystonia will continue to be essentially a dystonic condition. They will not develop cognitive problems or Parkinsonism or other sorts of complications, while certain other forms may have other problems. So, for example, a condition called Pla2G6 related dystonia may develop Parkinsonism, may develop cognitive problems, pyramidal problems. So that's the reason I think we would like to know what is the underlying genetic cause. The second thing, of course, is we already alluded to a little bit about the treatment outcomes, what is to be expected in the future, and there might be specific treatments once we know the pathophysiology, what is the underlying basis, the biological basis of different genetic forms. Then there might be individualized specific treatments for particular genetic forms of dystonia. So some of the recessive disorders, which we know, may be related to an enzyme defect, and maybe helping that might be important, and so on. So it has a very important basis to know what is the underlying genetic cause.